Welcome to my channel. When a pregnant mother has a miscarriage, he has emotionally become upset. Many people ask questions on my video comment boxes about why their period haven't started yet after 1 or 2 months since the miscarriage occurred. So in this video I will discuss about when does the period start after miscarriage, what are the causes of delay period after miscarriage, what should be done if the period hasn't started after a miscarriage. So let's get started. When does the period start after a miscarriage? It depends on two factors. Number one, what type of miscarriage did you have? And number two, your menstrual cycle. Generally, there are three types of miscarriage. Number one, spontaneous miscarriage. Number two, medical miscarriage. Number three, surgical miscarriage. Now, firstly, discuss about the spontaneous miscarriage. This is referred to a miscarriage that happened naturally without any intervention. For example, if you experience suddenly abdominal pain and bleeding after a few weeks of conception, you might find out that have a spontaneous miscarriage. Spontaneous miscarriage means miscarriage has occurred naturally. It is not induced miscarriage. If a spontaneous miscarriage occurs, you may experience bleeding for 3 to 4 days. However, after 3 to 4 days, there should be no more bleeding because the abortion is complete by this time. Following a spontaneous miscarriage, your period will return based on your usual menstrual cycle. If your period is regular, for example, if you have 28, 30 or 35 day cycle, then your period will start after a spontaneous miscarriage according to your menstrual cycle. For example, if you have 28 day cycle, your period is likely to start 28 day after the bleeding from the miscarriage stops. Similarly, if you have 35 day cycle, your period is likely to start 35 days after the bleeding from the miscarriage stop. However, keep in mind that cycle can vary. In any case, after a spontaneous miscarriage, your period should typically return within 30 to 40 days after the bleeding stops. Number 2. Medical miscarriage. If you have taken medication or followed a doctor advice to induced abortion, it is referred to as an induced abortion or medical miscarriage. The timing of when your period will start after a medical miscarriage depends on the type of pill you have taken and how you have taken them. Taking pill for miscarriage does not always result in a complete miscarriage, especially when taken at the wrong time or using the wrong method. In many cases, various complicated issues may arise due to the incorrect timing or improper administration of miscarriage pill. If you follow the correct procedure and take miscarriage pill under the doctor advice, you will experience bleeding for 2 to 3 days after taking the pill, and the miscarriage will be completed. Sometimes light bleeding can continue for 7 to 8 days. After a medical miscarriage, if there is no bleeding or spotting within 30 to 40 days, it is sign of complete miscarriage. Sometimes light spotting may occur during this time. It is important to have your period within 30 to 40 days from the day of bleeding stop after a medical miscarriage. When your period starts after a medical miscarriage, it might involve the slightly more bleeding than your regular period. If bleeding occurs for 10 to 15 days after a miscarriage or bleeding occurs intermittently for a few days, then we recommended having an ultrasonography. The purpose of doing an ultrasound is to see if your miscarriage has been completed entirely. When the conception occurs, the uterus of the mother forms the embryo, the placenta, the sac of the baby, etc. If there is a miscarriage, everything comes out through bleeding from the uterus. If for any reason something remains in the mother's uterus, we call it an incomplete abortion, which means the miscarriage has not entirely completed. In cases where miscarriage does not occur completely, there can be abnormal bleeding from the mother. At this time, if an ultrasound is performed, the ultrasound report might indicate written product of conception, the meaning that there are remains of pregnancy within the uterus. When there is an incomplete abortion, doctor often recommended a method called DNC. DNC means dilatation and curettage to fulfill complete the miscarriage. DNC is a minor surgical procedure used to remove pregnancy tissue. The miscarriage completed through the DNC method is called surgical miscarriage. After a DNC, there might be bleeding for 1 to 2 days. From the day of your DNC, it is expected that your period will start within 30 to 40 days. During a DNC procedure, part of the endometrium, the inner lining of the uterus, may be affected and damaged. As a result, when your period begins after DNC, you might experience slightly lighter bleeding compared to normal due to the damage of endometrium. What are the causes of delay period after miscarriage? Delay periods after a miscarriage can occur due to various reasons. Number 1. Pre-existing irregular menstrual cycle. If your periods were irregular before the miscarriage, it is possible for your period to be delayed after the miscarriage as well. In such cases, you might experience period 2 to 3 months apart prior to the miscarriage, leading to be a delay period after the miscarriage. Number 2. Conception risks. After a miscarriage, if you have unprotected sexual intercourse, there is a chance of getting pregnant again. If you don't want to conceive, it is important to use effective birth control method after a miscarriage. Number 3. Hormonal changes. Sometimes the body's hormonal variance can be disturbed after a miscarriage, leading to delay periods. Additionally, cysts might develop in the ovaries post-miscarriage, future causing delay periods. What should be done if period has not started after miscarriage? If your period does not start after miscarriage, there are recommended steps. Number 1. Wait for 25 days. After a miscarriage, wait up to 25 days for your period to return. If your period does not return within 45 days, take a pregnancy test. If the test is negative, wait another 15 days or up to 2 months after the miscarriage. If your period still has not returned after 2 months, please consult a gynecologist. They will check your hormonal level and perform an ultrasound to identify any underlying causes. Depending on your problem, they might prescribe hormonal medication to regulate your periods. No more today. Hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to my channel to get health advice, health awareness and reproductive health related all the videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.